our previous video, we discussed denial code CO29 and how it might leave you scratching your head. Today, we're going to be delving deeper into the solutions for CO29 denials. If you missed the previous video, be sure to check it out for a more comprehensive understanding of this particular denial code. But for now, let's explore some helpful tips when it comes to preventing denial code CO29. Before we get started, I want to have a quick recap session. Now, denial code CO29 is triggered when a claim is submitted after an insurance company's specified time limit for filing. Apart from simply submitting your claim after this designated time frame, here are a few more common causes when it comes to CO29. A lack of updated fee schedules can warrant your practice receiving denial code CO29. Fee schedules are a complete listing used by Medicare to refer to the fees paid to providers and suppliers. Unfortunately, providers can sometimes forget to update their fee schedules, inadvertently leading to this kind of denial. When patient eligibility is not verified before providing a service, this can result in denial code CO29. By not verifying eligibility and benefits first, providers will likely face delays in their claim filing process. The more delays in filing your claims, the more likely you will face late filing denial codes. And submitting more than one copy of the same claim with identical services can also trigger denial code CO29. Duplicate file claims can happen when you don't receive claim submission confirmations and use different billing data for the same service. Duplicates can also occur when billers do not check a claim status before resubmissions. We've all heard the saying, "Prevention is the best medicine" before, and that's because it's true. This actually applies to medical billing just as well as the actual medical practice. So let's take a look at some solid prevention methods when it comes to avoiding CO29. To avoid repeat CO29 denial codes, you can start by familiarizing yourself with the filing timeframes of the payers you work with. Also, be sure to utilize clearinghouses to inspect your claims before submitting them to payers. This way you can pinpoint errors in your claims and avoid missing timely filing dates. Prompt documentation is another important tip to keep in mind while navigating any situation in medical billing. With claim denials such as CO29, this allows you to readily have information at hand to help support any appeal you might need to submit. The last thing you want to do is be scrambling to find proper documentation while handling denials and rejections. Finally, always keep a keen eye on claim statuses. Clearinghouses help you to check the status of your submitted claims, providing once again to be an important tool to have in your billing and coding tool belt. Make sure you pay attention to the terms and conditions of the insurance companies you work with. Payers' contracts include a clause stating that they are not responsible for claims received outside of the timely filing limit. This is why we suggest investing in a clearinghouse for an extra layer of protection and a sense of security, no matter what kind of denial code you are faced with. Doing so will not only strengthen your revenue cycle management system, but encourage a seamless administrative process for your organization. If you'd like to learn more about denial code CO29, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.